Today's breakout session mainly deals with innovative approaches in the treatment of trauma. Dr. Carrillo will be talking about adult-specific trauma or just trauma in general. I think I'm going to have them introduce themselves. And if you have any questions, how would you like it? Would you like them to ask at the end of the session?
Yeah, that would be good.
That would be okay. We will have the questions at the end of the session. So please, we'll start with Dr. Ricardo Carrillo.
We've got to speak into the mic, is that right? Is that part of the deal? We have to speak into the mic because we're recording. Okay. My name is Ricardo Antonio Enrique Carrillo Chavez Santiesteban. But I thought my name was Pendejo. Estúpido, baboso, no sirves para nada. You're worthless. So I was raised in a home where the violence was so severe that I remember the pounding of my mother's body coming through my body to such an extent that even when I was a young man, I didn't feel that I had a backbone. My father was murdered in a drug deal in 1960 in the Mission District in San Francisco. And all my life, I wondered when I listened to my colleagues in Latino mental health talk about the beautiful families that we have in our culture, the wonderful balance and rhythm and harmony, and the beauty in the relationships that people had. And I would ask them where those families were, because that wasn't the kind of experience I had in my family. So that's the calling, and this business of trying to deal with folks in a healing way, in a traditional medicine way, is you have to have a calling. You have to have a calling, you have to have a gift, you have to have a don, you have to have something that pulls you to it, because the commitment of working with people who have been traumatized isn't just something traditionally that you get trained by. You can't really go to an institute, although there are now institutes of traditional medicine throughout Mexico and throughout Latin America. I'm a licensed clinical psychologist. I've been licensed since 1990. I've been working in the field of domestic violence since I did my doctoral dissertation in 1983, which was the male batterer, a multivariate social learning analysis, and I'm the senior editor of Family Violence and Men of Color, which is here and available in the library. So I came to the realm of trying to work with people from the batterer's perspective. My dad was a batterer. I learned to be a batterer. There were no programs when I was a young man. There were no programs for my father when he was in the middle of his trauma. And I've been instrumental in starting batterers treatment programs throughout the Southwest. In the last 20 years, I have concentrated more on treatment of trauma in general, being that I was PTSD myself. I wanted to study, everything there was about post-traumatic stress disorder. I had a co-occurring condition. I became a heroin addict. I, was an alcoholic. I used, crack and during the time when that was popular, and so that's how I tried to deal with that. And I found that I went through treatment programs, I went to 12-step programs, I went to AA, went to NA, and nothing helped me. I was a chronic relapser until I came to a men's circle, where we prayed to the four directions, where we paid attention to the elements, where we had a place of secure attachment that allowed me to really believe that maybe something different could happen for me. So I have been studying the last 20 years everything that there has been in the Western world around trauma-informed work and research of the neurobiology. I'm an expert around the neurobiology of trauma. And I can tell you that we are missing the boat, ladies and gentlemen. We are using methodologies that are very limiting in the way in which people who are traumatized, what they need. So let me just dive into it. This is just some of the series, some of the samples of cases that I'm currently working with. I've got a very full practice at La Clínica de la Raza. It's a mental health clinic in East Oakland. The approaches to post-traumatic stress disorder from our perspective these days that are most popular are the cognitive behavioral approaches, where we are really focusing in on left brain functioning. So language, linear thinking, rational thought is what we're concentrating on there. Prolonged exposure therapy that the military really enjoys focusing on and has done extensive research with it is another left brain approach with systematic desensitization, some hypnotic work to get people to relive the situation. If you've been traumatized, do you want to be in a program that's called prolonged exposure therapy? Let's consider again. We're only using one certain part of the brain. EMDR, which is the desensitization and reprocessing, very effective strategy. One of the more effective strategies in the Western school of thought is effective because you're trying to process. You're trying to process what is a right brain, limbic-oriented experience into the left brain so that people can understand what's actually happened and they can develop the language. You can develop the words to be able to speak about what actually happened to you. So let's be aware, Bessel van der Kolk speaks about this extensively, that when you're traumatized, when you are in a life-threatening situation, in a natural disaster, somebody is trying to kill you, you're in a war-torn situation, you're in a chronically domestically violent situation, your limbic system is activated. Right brain flashing back, reliving the situation. Your left brain and frontal lobes are offline. They're not even in the ballpark. So why are we using cognitive behavioral therapies to try to treat somebody when the left brain capacity is not even activated, not even online? These are all of the systems that are affected by trauma. You know about them. I'm not going to explain to them. The symptomology that people bring into them are these situations. People are reliving the traumatic memory. They don't want to talk about it. I don't have the words. I cannot tell you what happened to me. And I will give you a case example if there's time about how we have to be able to manage that and work with that. State of hyperarousal is very real for people. They startle responses, they can't sit still, they're super anxious, they can't deal with the day-to-day life situation, and it affects who we are. Let's remember with trauma, one of the things that we have to attend to is survivor guilt. Somehow I always think that I'm responsible for what happened. I had Vietnam veterans from Porterville, California, who would say, you know, the most traumatic thing was I came home. I came home. And they didn't. The other guys didn't come home. And Porterville, per capita, has the highest rate of war veterans that did not come back from the Vietnam War. So it affects who we are, and it affects our ability to connect and to be related to people. And so the very first thing that we have to attend to, no matter what we use, what methodology, what therapy, what treatment approach, is we have to have a secure attachment. The patient who is traumatized has to feel from us that in fact we are able to handle whatever it is that they bring to the table. The patient needs to feel that they're being embraced and that the time that we're spending together is safe. How do we do that? How do we as human beings present ourselves to be available to somebody, to be able to be present and make it safe for them? You can't do it alone. So in the traditional medicine way, I'm going to shift very quickly into this. The medicina tradicional de Mexico, the Mesoamerica, really had a very comprehensive way of looking at medicine and the treatment and the healing of people. Remember, when Cortés came to the Americas, he told King Felipe and Isabella, don't send me any physicians. There are very good ones here. There was already a very extensive catalog system of herbal usage in Mexico. There was already surgery that was being conducted. There was already an understanding of massage, meditation, and mindfulness that existed in Mesoamerica before the coming of the Europeans. So these traditions have been in practice for a long time. They're called all kinds of different things. But for our purposes, the important thing is what's relevant to the treatment of susto or trauma. And what it is you have to be connected to the anima, you have to be connected to a higher power. This is a spiritual practice. So the healer, the person involved with the healing, has to be connected to the universe in a way that allows that person to handle the management of the energy that the person is frozen with at that particular time. So what we're doing here is understanding that the vision of working with people is through the spirit, through the heart, and through the liver is the way it's explained in a traditional medicine point of view. You have to be connected to the spirit, your heart has to be connected to the earth, and you have to be able to breathe. And so our relationship is, in the Western thinking, we've had this idea of biopsychosocial spiritual, approach, comprehensive approach to helping somebody in recovery and healing. That's fine. We're going to take it another step. Take it another step from the traditional medicine place is be connected to the spirit. Because the reality of the fact is when you're traumatized, you lose something of yourself. So you can't heal if you don't call that part of you back. How many of our traumatized people are disassociating? They go to a corner in the room. Their mind goes someplace else. Their spirit is no longer there. It's part of the anxiety. So part of the intent is to call that back for them. Get people to really become emotionally connected and understand what their heart is telling them. So we've got to be able to model that for people. The hardest thing for the people that come to see me is to do this very simple exercise. I want you to breathe in and I want you to breathe out with me. Breathe in and exhale. Breathe in and hum with me. Let it vibrate in your stomach. Remember, this is right brain problem. We have to get into the body. Breathe in again and vibrate. We're teaching the patient to be connected to the breath, to pay attention to how frozen the body is, and how to make them aware of what they need to concentrate on. Breath is crucial to the process, just as it is that this entire process is integrated. In the now what prayer, we say, Donat you, Father Sky, Donat Sin, Mother Earth, Donali, our spirit, to be connected. The east is the direction of the men, the west is the direction of the women, the south is the direction of the children, the north is the direction of the elders. In connection, Father Sky, Mother Earth, Spirit, connected to all of those directions, you become whole. The intent of the traditional medicine is to be whole again. So, do we need water? Absolutely. We need to hydrate. We need to be able to use the water. This is a very important lesson here coming from the traditional healers. Water is the blood, earth is the body, heat is the spirit, wind is oxygen. So these teachings have to do with being integrated, being balanced, and being connected to the elements that are necessary for us to live in balance, rhythm, and harmony. So the treatment of choice is very simple. Cleansing. What we call una limpia. And the limpia is done by using all four of the elements. The limpia includes using herbs. There are particular herbs that have powerful energy and essential oils to help with the cleansing of someone who is startled, somebody who's frozen, somebody who's psychically and psychologically numb. The interesting thing, the egg is that part for the air, because there's a part that's still from the yolk and the shell that there's space in there for it to grow. That's what really absorbs the energy from the person when we're using that to really pull that out. When the cleansing is done and you use the egg, you will hear the yolk get hardened, and that means that you've been successful at being able to pull whatever energy, negative energy the person has. Some curanderos like using mezcal. I use flowered water to help wake up the nervous system, to open themselves up to be able to take in the cleansing. And then the smoke is used as a blanket, if you will. And now every single one of the elements has been used. The earth, the air, the water, and the fire, to be able to bring some cleansing to the person. Now that's just the very beginning. How am I doing on time? Am I good? Okay. So let me say how I, as a licensed psychologist, have incorporated traditional medicine to deal with trauma. I have a family of Salvadoreños, gente who have migrated from El Salvador. They get robbed at gunpoint. Their van gets taken. There's a husband and wife and a sister-in-law who's younger than her sister, and a 4-year-old girl in the car when they get robbed. So the family comes in, immediately wanting to be addressed and taken care of. So we begin the process of understanding what's actually going on, what's happening with the family. I see each one of them individually. I notice that the man can talk about what's happened to him. He's fairly numb. His affect is blunted. He's not really very connected to what's emotionally to what's going on, but he's willing to disclose it. He's willing to talk about it. So first step is pretty good. His wife cannot discuss what's going on. Her hands are shaking, she's trembling, I can't talk about it, I can't talk about it, I can't talk about it. Their younger sister is even more distressed. So I send the women to a sobadora. A sobadora is somebody who does energy work, does body work. It's the practice of la sobada. El sobador in Mexico is somebody who does the energy work by doing massage and chiropractic adjustment, but they're really energy shifters. So she helped set the stage for the women to find some self-soothing practices, certain teas that they were to take, breathing exercises they were to participate in, and the sobada for people from Central America and from Mexico is very a healing thing. When you come in to see somebody and they get touched immediately and get welcomed and get given a glass of tea, somehow they feel like, okay, you're going to take care of me. That's a very different way of practice than the objective traditional approach we get taught in graduate school, yes, where one sits in a chair opposite the room of your patient, almost not wanting to be touched or to touch the patient. In this practice, touching is essential. Getting your hands dirty is essential. Being available and present and working with your patient is essential. So they went to see the sobadora. When they came back, I did the EMDR. Well, that went great. Doing your bilateral stimulation and then I noticed, I said, you got robbed at gunpoint, nobody got shot, nobody got killed, nobody got hurt, you got stolen. What's really going on? What's happened in your life before this? And the young one says to me, well, when I was 9 years old, my uncle came to the house and he shot my father. And I held my father's head on my lap while he bled out. And my mother tried to intervene. And the guy who was with my uncle pulled out a machete and chopped almost one of her arms off and then cut her on the other arm. And she's been carrying the family secret. She's now 27. So 9 to 27, whatever, she's been holding that. Okay. But she begins to talk about it. The EMDR opens it up. Takes us 5 sessions to walk through the EMDR. And then the traditional healer who's here, Lorenzo Lopez Nunez, came to the Bay Area. He's my teacher. He's this person that I'm studying with because he's a specialist in trauma. and offered a session of avuncular acupuncture. A very effective strategy for working with PTSD, reducing, relaxing the central nervous system, getting people to get some clarity. In private, you don't have to say anything. You can just participate in that. So they got that. And then Laurencio gave them all an initial limpia, a first-time cleansing. So with this family now, one of the good things in the state of California is we have a program called Victims Compensation. So all of you therapists wanting to get paid, take victims compensation. They give a good reimbursement rate, and you can treat them for a whole year. So in the last 6 months that we've been working individually and as a couple, this family no longer has a state of hyperarousal. They have learned how to drink teas, how to do breathing exercises, how to do meditation, how to go for walks together. The couple is formally going to resolve their compromiso with each other, their commitment to each other. They're getting married. The young woman who I treated initially is talking about getting pregnant with her husband. And the little girl, when she comes in, immediately asks for candy and wants to know, can she get her little piece of ruda or romero, because that helps her soothe herself. And the smell of the rosemary or the smell of the ruda is what helps. So I've got patients that come from Guatemala, Mom-speaking Mayan people who have been displaced by certain communities where there's been political strife, trying to get asylum here in this country. So there, not only do we have trauma of them in their country of origin, but we have historical trauma that they've been displaced. And so the same kind of process is helpful, not for everyone. There are some people that aren't connected to their traditions in that way. If for some people this is actually offensive to them to use an egg or to use herbs or to use mezcal for a cleansing, but they are willing to pray in their Christian way and they're willing to be attended to in a way that they know that from the traditional medicine person, you're going to be able to handle whatever it is that they do. At La Clínica de la Raza, I am the psychologist assigned to manage the traditional healing workshops. So we have traditional healing people that make presentations monthly. They're available for referrals. Nobody, except for this crazy old psychologist, is willing to learn these old traditions to apply them in my practice. My practice has now changed significantly. I do the trauma treatment by the treatment of susto. My job is to try to be available, shift the energy, get rid of the negative energy of the people that are frozen in their trauma, be able to open themselves up to the possibility of having a life that they want, that they need to be available for themselves. So the prayer, I want to end with a prayer. I pray for the children because they have a long way to walk. I pray for the elders because they've walked a long way. And I pray for us that have to take care of them. Thank you. So I got a few minutes for questions. Any questions, thoughts, reflections, or new jokes? I've taken new jokes.